Hi guys, so I wanted to talk about something, kind of rant about it. So I'm not gonna do like my normal setup. One, because this is just like a casual video, and two, I don't think it's bright enough in my house right now. Because for whatever reason, that camera makes everything darker whenever I start recording. And I don't have overhead lights in my living room or in my bedroom. I'm not sure why, it's just how the apartment is. So I have to rely on lamps because it's nighttime right now, so it's dark outside. So anyways, if you guys remember, in a couple videos ago I talked about my tooth pain that has impacted molars or wisdom teeth. And I said that I have an appointment, and that appointment was yesterday. And let me tell you, it was horrifying to hear what the oral surgeon had to say. So they took x-rays, Sorry, I'm just switching arms here. So they took x-rays, figured out, just so they can see what was going on. And so the oral surgeon kind of talked about what would happen. They would remove 5 teeth total, because apparently all of mine are impacted, and I also have like another random impacted tooth right, in this area, bottom left. And he was talking so fast, and so, not fast, but he said so much in a short amount of time that it's just very overwhelming, and like I couldn't really decipher what he was saying. Like, okay, you have to remove stuff. Got it. So then, with any type of surgery or procedure, the doctor will go over the risks. Boy, did he go over the risks. In fact, that's all he went over. So really, I think the first risk he went over is I'm on psych meds, depression and all that. So and he said that they would make the anesthesia or whatever not be as effective as it would on someone that doesn't take those medications. So they might have to use more on me than they would on somebody else, and that could really inhibit my breathing. It can make me not breathe so good. So I'm like, okay, that's concerning. And then he was talking about risks with actual surgery. Like, so I have a couple of teeth I need removed from the top of my mouth. And he said that although it's rare for it to occur in people under 50 years old, it is possible for there to be a hole created because of it in between, I think he said in between like the sinuses and mouth, which would not be good. And he said in his career, I think that's happened like 5 times to him, which I'm not sure how long he's been an oral surgeon. He could be, one for 6 months, and that would be quite a bit. Or, 20 years, that's not bad. He didn't really say his experience. Oh, sometimes doctors do things like that to reassure you, sometimes that they don't. I mean, he's a dentist. He's not really a doctor, but, not to discredit any dentists out there. You guys do important work. And then another thing was, he told me, because like I said, I have 2 teeth down here that I would need removed, like completely, because I think they're decaying or something like that, something weird like that. Unfortunate. And it could damage the nerve right here and could temporarily or permanently make my mouth numb. And he didn't say how common that was, but I looked it up, and apparently it's pretty rare that happens. Like, not worth talking about it as long as he did. Rare. And then, because he had me, leaning back in the chair so you could check it out. And while he's like, have you ever been diagnosed with sleep apnea, or has anyone ever told you that you snore loudly or heavily or whatever? And I said no. And come to find out, I guess she asked me that because my airway is obstructed. I can't remember what he said, because he didn't say that, but he said something about my airway. And I was like, well, what do you mean by that? And so he said that. And just because of how I was made, basically, it's just my anatomy. And then he said, told you guys, I think I did, this appointment scared me so much. It put so many unpleasant images in my mind. So he's like, it means that if we had to intubate you, it would be difficult for us, as opposed to someone who has a clear airway. Okay. Who said anything about intubation, I thought I was just getting some teeth removed. So I was in the office with him for maybe 10 minutes. 9 of those minutes was doom and gloom. Everything that could go wrong. What we would have to do if the anesthesia doesn't work because of my meds or something like that, or if I had complications from it, and then it's like, well, we'll just see what happens whenever you're here. We'll just, And then the other minute was like, should you survive, here's what recovery will be like. It's just like, eat on the right side of your mouth, eat cold things, just rest for a couple days. And I'm not kidding you, that was like, usually whenever I've had stuff like this done, like a surgery or whatever, it's the opposite. They go over the risks, and they're very nonchalant about it, because I don't think that they want you to worry about it. They want you to be aware of it, of course. But they don't necessarily want you to worry about it. Just think about it. And then they go over the recovery and things like that for most of the time. Not the case with this guy. So, long story short, I'm not going to get the surgery done with this surgeon. I'm sure it's a safe procedure. From what I looked up online, it said that it was a relatively low risk procedure, and I think it is. I mean, because I've heard about, tons of people getting their wisdom teeth removed, and it's, no big deal. It's fairly common and a routine procedure and surgery, I think. But I'm not going to go through with it with this guy, because honestly, is he telling me the risks, or is he telling me mistakes he's made so that I'm aware of mistakes he might make? You know what I mean? It's just really weird. So what I need to do is make an appointment with another dentist, because my insurance doesn't, they don't take my insurance anymore, so I need to see somebody else and then get a referral for an oral surgeon, or maybe they do it in the office, a new person, I'm not really sure. So, that's how my appointment went yesterday. It scared me. I did not like the thought of me being intubated, or my mouth being numb forever, or having a hole, in my sinus area where there isn't already one. It's just, it was the most odd thing, you know. Like I said, you know, every procedure has risks. They usually go over it, 30 seconds, just, so you make sure that you know it. Because they're always like, and there could be complications, infection, whatever. And that's how they act, they're nonchalant, which helps you as a patient feel not so scared, because if they don't seem to be worried about it, then you don't need to, in your mind, you know what I mean? But this guy was acting like, yeah, it'll probably happen. I don't know. But, and the airway thing, I've never heard that before. I mean, me having it. I've been to a lot of doctors, I guess, for hormones, whatever. And so of course they do the checkup thing, they check in your throat. Not one of them has ever said anything about my airway, I don't know, I'm not saying he was lying or anything. Maybe he was wrong. I don't know. It's just so odd. So, I'll keep you guys updated. Maybe, if you guys care. I'm not really sure. If I'll just see somebody else get a second opinion. Because I was just thinking, like I said, are you talking about mistakes you've made? And the result of those? Or are you talking about very real risks because of the actual surgery, not because of something that you might do wrong? If you hear pitter-pattering, it's my guinea pig. Oh boy, oh. So, he's gonna go eat his hay. Alright, anyways, I will see you guys next time. Also, it's just, I'm not trying not to stress about it too much, because God will help me. He will guide me. He will lead me to wherever I need to go, whoever I need to go to get this done. I trust him for sure. I trust him with everything I have, everything I am. So, he's never done me wrong before, and I know that he never will. So that's why I'm just putting it in his hands, just letting him lead me. So, anyways, I'll see you guys next time. God bless you all. Bye.